Welcome to Sans Apologia. My name is Jeffrey Rubenstein in Tampa, Florida, and this is a podcast to discuss in depth a variety of topics such as creativity, history, current events, music, art, spirituality, philosophy, or any other topic with which I can foster a rich, dispassionate, and well-referenced dialogue with a host of knowledgeable people. The idea would be to supplement the discussion with references. Listeners could check the website for links or any of the sources we discuss. Feel free to message me with questions or comments, and I'll read them on the podcast, and we can take calls in the future. Today, we're going to be talking about something that nearly anyone can relate to, and that's confronting our very broken and labyrinthine healthcare system. I'm going to be speaking with healthcare advocate, videographer, filmmaker, and journalist from Philadelphia, Pennsylvania, Bob Finkelstein. Bob has been a healthcare activist for nearly 15 years, starting when he was driven to do something about the astronomical price increases of the drug he takes to manage his multiple sclerosis. Bob has not only experienced firsthand how challenging it can be to manage a serious health issue, but also how challenging it is to try to do something about it by confronting politicians and testifying on Capitol Hill. Bob, welcome to the show. Thanks for being here and giving us a chance to learn a lot more about what it takes to take on the enormous task of trying to make healthcare in this country more affordable. Why don't you briefly tell us how you got into this?
Yeah, thanks for having me on. I'm glad to have the opportunity to share my story. I think it's an important topic that affects a lot of people in this country, and so it's great to be able to share my story.
Sure.
But I was diagnosed with multiple sclerosis in 2003, and so I've had it for 20 years and have been navigating the American healthcare system for that whole time. And I've also been buying insurance on the individual market. I'm a freelance worker, so I've got a lot of experience just, trying to learn about the different plans that are available and how that affects the affordability and access to healthcare. And I've also lived through, the changes in the American healthcare system because the Obamacare legislation in 2010 really had a big impact on the affordability of my health insurance.
Okay, so what changed there?
What changed was before the Affordable Care Act was passed, which is commonly known as Obamacare.
And we're talking about 2000 and
2010. That was passed in 2010,
Okay.
but I don't think it went into effect until 2014, fully
Okay.
into effect, if I'm remembering correctly. But before that act was passed, there was no limit on annual out-of-pocket expenditures that the health insurance plans could charge you. So, and then after it took effect, there was an annual cap on out-of-pocket expenditures.
Mm-hmm.
So it started at about in 2014, it started at about $6,000 a year, which was the maximum amount that you would have to spend on healthcare, no matter what the cost of your treatment.
Okay. Almost like a deductible. That was the maximum.
Yeah, well, it actually includes the deductible.
Okay.
But before that, the health insurance companies would charge you a percentage of the healthcare cost on the total healthcare cost. So if you had a 20% copay and you had $500,000 worth of expenses, you would pay $100,000. So there was no limit, and bankruptcies were a lot more common back then.
Okay. Does the cap change? Does the cap increase, or it's the same, 6,000?
Yeah, the cap increases each year. It's currently $9,100 in 2023, and it's going to go up to like $9,400 in 2024. It's not cheap by any means, but it's a lot more affordable than 20% of a large healthcare cost. If you need it if you have an accident, or if, in my case, you need access to an expensive medication that helps manage your chronic condition.
So let's go back to that. In your specific situation, the medication was obviously extremely expensive. And that's how you got into this, because you began to research why the costs are so high.
Yeah, it's extremely expensive. It didn't start off that way. It was expensive, and back then it's what I considered extremely expensive. But it was nothing compared to what it wound up costing as years went on.
And you don't mind saying what the drug is?
Yeah, not at all. It's Copaxone, which is manufactured by Teva Pharmaceuticals. When it came out in 1997, which was a few years before I was diagnosed, it cost about $10,000 a year. Before the generic was introduced, it peaked at about $80,000 a year, $86,000 a year, something like that. So I was responsible in my pre-Obamacare plans for first 20% of the cost of the drug, and then it wound up being something like 40-50% of the cost of the drug when I was switched into a different plan. And the price of the drug went up really rapidly.
Now, this is
And
after coverage. You're talking about with the current insurance coverage.
yeah, I'm talking about with the coverage. That's how much I
Right.
was paying. Yeah, so as the price kept going up, my out-of-pocket costs kept going up before Obamacare, and I realized I wasn't going to be able to afford the medication at some point, and I wanted to try and do something. Get answers for why. First, it was trying to get answers for why they needed to increase the price of a drug 15-20% a year for a drug that had been around for over almost a decade. And over a decade by the time I started doing some stuff.
Okay, so what did you find out? You're trying to find out why this drug is so expensive?
Yeah, I mean, that was like my first step at activism, I guess, was calling up Teva Pharmaceuticals, which is the manufacturer of my drug, and trying to get answers from their executive offices, which happen to be located in the state of Pennsylvania, where I live.
So did you do like a Roger and Me documentary style, where you storm the lobby and try to get inside to talk to the exec? I mean, what's his name? Roger? Is it Moore?
Michael Moore.
Michael Moore.
Yeah, I should have done that, but no, I tried to go a more subtle route. I used a phone, and which I guess was my first mistake. But yeah, I called their offices and spoke to one of the assistants in the executive offices and let her know, told her what my question was about the drug prices and asked her if there was anybody at the company that I could speak to. And she said she'd pass the message along. Didn't get any response. 2 weeks later, the company had a nurse call me back and say that the company had told her that I needed help with my injections, which was kind of, to me, a big slap in the face. Because there was no way like my question could have been misinterpreted. So it just angered me.
It wasn't.
Yeah. I think they were trying to send me a message.
Yeah.
Which I received, and I just decided I was going to try. It just motivated me to try and find different avenues to try and tell my story. Just because I thought it's important for people to know what awaits them. Because the reason I think why our healthcare system is so messed up is because a lot of people don't think that something like this is going to ever happen to them, and they don't necessarily think about its relevance. And for a long time, I was that person. I had no idea that I was going to have to confront these issues at any point until one day I woke up and I wasn't feeling well, and I didn't know why. And but that can happen to anybody.
Sure.
So that's why I think it's sort of like an important issue for people to understand, because more likely than not, it's going to affect them or some person
Sure, or
who
their
they love or
children.
care about.
Yeah, exactly. Or they see it in their own family, or they see it with their elderly parents. So that was the first attempt to trying to get some answers. What did you do next?
What happened next was, this was around the time that Obamacare was starting, or that Obama was trying to pass legislation affecting the healthcare system, and there was a lot of effort to push back against that. And I reached out to some healthcare advocacy organizations, trying to find out if I could add my name to a list of people that were available to the media to tell our stories, so that people could understand what the issues were. So I gave my name to a group called Healthcare for America Now, told them my story, and they wound up passing my name along to reporters. The only call I wound up getting was from a wire service in France, and they sent out a news crew, like a 2-person news crew, and they did a video story about me. And we went to the pharmacist, and I bought my medication, and they interviewed me, and it ran in France or something, I don't know.
Yeah, because
But
they were probably doing a documentary on how absurd the American healthcare system is. People couldn't believe it
yeah,
probably over there. It's like reality TV or something.
over there in Europe, they understand that access to affordable healthcare is a necessity, so they really take care of it. It's a whole different mindset than in America, where we look at it as like a profit center for companies and executives to make more money. And I think it's a horrible way to look at things. You know, CEOs getting bonuses not for doing anything other than raising prices on drugs to astronomical levels.
Well, that was actually
So,
something I wanted to ask you about, and I thought we would probably summarize with this point, but I guess it's pretty obvious. If part of the problem is the fact that the United States has profitized healthcare, is that a big part of the problem? Why healthcare medications are pharmaceuticals are so expensive? Why the
yeah,
insurance coverage copays are so expensive?
I mean, yes, that's a huge part of the problem. It is the problem. Um, they look at sick people in this country as profit centers and taking money out of their pockets in order to boost profits, and they don't focus on accessibility, on increasing efficiency. They don't focus on creating better, efficient, cheaper drugs. They focus on creating a drug and then or service and keeping the price high as long as possible
Yeah, because
until it.
it's not financially expedient to solve a disease or cure diseases. You're not serving your shareholders.
No, you want people to have to take drugs for long periods of time to manage their conditions, and be able to raise prices on those drugs for as long as possible. And that's what people do. There's different issues, some affecting the pharmaceutical industry, but also some affecting the health insurance industry. They find ways
And
to.
they're tied to legislation. They're tied to the problem, K Street, lobbyists, and legislation,
Yes,
right?
yes, I'm sure you and anybody listening to this who's not familiar with the healthcare industry or lobbying would be surprised to find out that the pharmaceutical industry spends more than any other industry in the country on lobbying Congress by far. So it's just kind of absurd why
More than defense.
more than defense and oil,
That's
which
saying something. That's
is
saying something.
crazy.
So, right. So, our incredible financial empire is premised upon war, disease, and a fossil fuel.
Yep. But
That's really symptomatic of society in general.
yeah, it's just making money. They don't really care about other issues. That seems to drive a lot of the behaviors. It's corporate profit.
And because they're so tied in with politicians and legislation and lobbyists, as you know from experience, it's very difficult to go up against that system. So, what kind of pushback did you experience when you started to you started to speak and you were getting a little bit more higher profile in terms of you were writing editorials and things like that, and then some of the other experiences that I know that you've done in terms of testifying in front of Capitol Hill, if I got it correct?
Yeah, I did a bunch of things, and I just got to clarify. In terms of the advocacy that I do, it's not the main focus of what I'm doing. It's something that I've done intermittently over the years, but I do have exposure to a fair level of advocacy efforts, both speaking at rallies, um, going into congressional offices and meeting with staffers and Congress people.
Both on the state level and in Washington, D.C.
Yeah, and on a federal level too. And that's interesting. It's interesting when you start to push back and sort of find out what people's attitudes are about creating an effective and affordable healthcare system for people. It's quite shocking.
So
How
what was shocking? What was an experience that you had where you were trying to, show somebody this information or testify to, how the problems that this is creating, and then what are these politicians supposed to do? How do they respond?
Yeah, well, my very first experience with approaching a congressperson was at a 2010 Obamacare town hall before the law was passed. And I had a congressman tell me basically that my illness was a job creation program for his district, so he couldn't do anything to keep my medication affordable.
And who is
And
this? Who is this
uh,
wonderful?
Well, he's a representative who represented part of the state that's a little bit west and north of Philadelphia. Um, but I was shocked that he could look somebody in the face who has a chronic, potentially life-threatening illness and tell them that he couldn't do anything to help them with drug care prices because it accounted for too many jobs in his district. Like, he literally said that to me in a private conversation. I think most people would be shocked to hear something like that, but that's the attitude, and you encounter that at all levels. Even worse was in 2017, after Donald Trump got elected, the MS Society asked me to, as well as other people who have MS around the country, to come in and lobby our members of Congress. So I think there's about 100, 200 people who go to Washington, D.C. They liked what I had to say, so they asked me to lobby some members of the Senate Finance Committee, which was going to be writing the legislation that was potentially going to replace Obamacare. And I basically had a staffer. We went in to meet with the staffer for the Senate Finance Committee, and he told us there were going to be changes to the legislation that we didn't like because elections have consequences. And like I said, he's just like, elections have consequences, and there are changes coming to this legislation that you're not going to like. And we're like, what changes? That my medication is no longer going to be affordable and I'm going to wind up in a wheelchair? Like, like, this is what you're talking about.
What were the changes?
We didn't know. We never got to that. They knew that I had a pretty powerful message to deliver, so they asked me. After he said that, we all sat down at a conference table, and they were like, well, we brought Bob along to help explain his story so that he could help you understand what's at stake. And I basically told him if he didn't get the legislation right, that he was going to bankrupt families, people were going to die, and this was going to be, and people were going to have worse outcomes than what they would do if they got the legislation right. And if they didn't get it right, it was going to be because of him and all that, and he kind of shut up. I wouldn't say he shut up after that, but he got a lot more respectful and started taking notes and, just listened to what we had to say. But again, he's some political staffer, and they think that this is a game, like of winners and losers. And it's not a game. It's people's lives. And it's, it's not just me. It's thousands of people across this country, millions of people across this country, that what happens to their healthcare affects their finances, affects their families, affects their outcomes of whether or not they live or how badly they're affected. So it's
and if they live, if they're gonna, even if they survive, they're whether or not they're gonna have to live the rest of their life out in enormous debt.
Yeah, exactly. The number one cause of bankruptcy in the United States is medical expenses.
Yes, I've heard that.
Yeah.
So what do you think would have to change? I suppose if politics is, I suppose there's no other avenue to try to make changes to the problems in the healthcare system. What do you suggest is a more realistic approach?
I just think the approach that's used now, which I call victim culture, is not a great approach, because
so you're talking about the approach that advocacy groups have taken to address the problem.
Yes. The current mindset is that let's trot out Bob and other people with sob stories to get on stage and tell their sob story and make people feel sorry for them, so that we'll get legislation that will make that will make healthcare affordable for everybody.
So, and you're saying that doesn't work?
Look at the system that we have.
Right.
Does it work? I mean, I think
apparently nothing has worked.
Yeah, there's changes, but I think
right. You described some of them earlier, the cap on out-of-pocket expenses and some of the changes that Obamacare brought.
Yeah, but they tend to be incremental, and you're always living in constant fear that they're going to be rolled back. I don't know if you remember when Trump tried to repeal Obamacare back, I think it was 2017.
Oh, yes. This was John McCain's shining moment of glory.
Yeah, and that came at 2:00 in the morning, and I was on vacation, and I was literally up at 2:00 in the morning, refreshing my screen every 2 minutes.
Oh, right. Okay, so if what you describe as victim culture is clearly not working, trotting out people to try to get an emotional response, try to appeal to their emotions, if this doesn't work, what's the better approach?
Okay, but I just want to be clear that it does have some impact, but I think you could have a greater impact. Because groups like the MS Society do make some progress, but I don't feel comfortable going in and begging people for money for something they should be doing in the first place, because it's just the right thing to do to help their constituents and to make people's lives better in this country. That's why we send them to Congress. That's what they should be doing. But I think the better approach is just to air the dirty laundry of people, like the people who are representing us, to publicly embarrass them, which I think is the best motivation for action usually for these politicians. When they find out, when their constituents find out how horribly they're treating people, that's usually when the changes occur. I can give an example from my own experience. When Pat Toomey in 2017, I reached out to his office. He's one of my
And
U.S.
who is he
senators.
again?
Yeah, he was a U.S. senator from Pennsylvania. He was a Republican, and our other senators are Democrats. So I knew what his vote was going to be. But Pat Toomey was probably going to vote to overturn Obamacare, which was going to have a huge impact on me if they didn't cap out-of-pocket expenditures. We're talking about tens of thousands of dollars of medication costs a year.
Right.
So I reached out to him. And I told them, I said, I sent an email, I called somebody on the phone, and I'm like, I would like to talk to somebody from the office just to explain what impact this is going to have. And they're like, we'll call you back, we'll set something up. Never got a call back. A couple weeks passed, 3 weeks passed, and I decided to write an op-ed about it, and the op-ed got published. It resonated with a lot of people.
Where did it get published?
It got published in the Philadelphia Voice, which is a citywide paper. They ran the op-ed, and the MS Society picked up on it, and other people picked up on it and started going around Facebook. And within 2 hours, I had gotten a call from Senator Pat Toomey's office telling me that they wanted to set up a meeting with me. So again,
what does a meeting do? Did the meeting just squash whatever it was that you were trying to do, or did they actually do something, or did you ever get to meet?
Yeah, I think it just wound up squashing whatever momentum. It was basically to kill the story that
they sort of managed it.
Yeah, and I did get to meet with them, and I met with one of his staffers, and we talked, and I explained this to him again. If you don't get this right, you're going to hurt people across the state. And just explain to him it's not only healthcare outcomes, it's people's futures, it's the financial situation, it's everything.
Did he try to get you to sympathize with the poor pharmaceutical companies and the people who will suffer?
No. That was yeah. But I asked him if he could find out if the senator was going to propose or support caps on out-of-pocket expenditures, and he told me he'd get back to me, and he never did. But it's just little stuff like that when you're trying to
and you don't see that you don't see that changing. I mean, what's the trajectory?
That's actually a really good question. I think the trajectory is towards a public healthcare system, because I don't think it can continue in this way forever. It's getting way too expensive. Not that it's not already expensive, but it's just becoming absurdly expensive. There's going to be new medications coming out that are going to make these old medications look cheap, and it's just
and they'll be coming out with they'll also be coming out with new diseases.
Yeah, I think they're working on that right now.
Yeah,
and as well as the commercials to advertise the
absolutely
the medications that they're making.
It's an industry. It's an industry in this country, and that's part of the problem. Yeah. And we said it before, the profitization of illness in this country is part of the problem. And it also de-incentivizes cures, affordable care, and also de-incentivizes sustainability, physical, health, and maintaining good health throughout your life. I mean, look at the way that the food industry sort of complements the pharmaceutical industry.
Yeah, for sure. I mean, the food industry probably causes a lot of illness, but people don't want to treat the root causes, whether it's dealing with the root causes of unaffordable healthcare or things like, our food system causing illnesses in people because it's too difficult and because too much money is at stake. But I just want to make one more point about how weird it is how politicians behave, even even this year, there's something going on where the health insurance industry across the country, but also here, my insurer in Pennsylvania changed a policy, and they wind up basically double charging people taking prescription medications for their out-of-pocket expenditures. It's kind of a complicated issue, but it's a simple issue for a politician to deal with, because in 16 states across the country, they've banned it. They've banned the practice, and this is
So explain that specifically. How does double charging work?
it's a bit of a controversial practice, but some of the drug manufacturers subsidize their drugs to make them more affordable. So they'll actually pay your copays on the drugs. Health insurance companies used to count this towards your deductible and out-of-pocket expenditures, but something changed during the Trump administration, and they allowed health insurance companies not to count those towards your out-of-pocket expenditures. And so they basically said, we're going to take the money from the health insurance company said, we're going to take the money from the drug manufacturers, but we're also going to take your money. So they would essentially take double the out-of-pocket expenses. But the only rationale for that is that I've heard that makes sense is to try to force people into generics if there's generics available. But some of these drugs don't have generics, so there's no excuse for doing that. So they're basically double charging people with cancer. Maybe there's some HIV drugs, but double for some of the medications. And there's legislation sitting in Harrisburg right now that would put an end to that practice. But at least in the Senate, the senator who heads up the committee, John DeSanto, is not letting it come up for a vote, even though it's supported by both Democrats and Republicans who co-sponsored the bill. And it's the second term in a row that he's not letting the legislation come up for a vote. And why not? It's just kind of absurd.
And his name again?
His name is State Senator John DeSanto.
DeSanto sounds a lot like what we got down here in Florida with DeSanto. What is it with these guys? What does that mean anyway? What does that translate to in Spanish?
Of the saint.
Oh man, that's ironic. Maybe it's of Satan.
Yeah.
Spanish is a bit rusty, but maybe it translates to that.
Yeah.
So does he have and there's no explanation as to why he's blocking bringing this bipartisan legislation up for a vote?
I don't know. I'm not sure. I spoke with one of the staffers on the committee or involved with introducing the legislation, and he said that he doesn't really have an answer, and he doesn't have any visibility into whether or not that legislation is going to be voted on. And it's such a simple thing. It's already been passed in 16 states, ranging from, I believe, like Oklahoma, deep red states, to like New York. It's not coming up for a vote here in Pennsylvania. I mean, I'm sure it has to do with corporations exerting influence on the senator.
I'd put my money on that.
But it's just another example and it was a recent change. So things were looking good, and it was nice. I was benefiting from these subsidies too, and it was nice. Like, it was making my healthcare more affordable, and then it got taken away, and it's just always something, and it's been 20 years of something. Right. It just never stops.
Right. No, that's a lot of stress and pressure for people who are already dealing with a very stressful situation.
Yes, exactly. You took the words out of my mouth. That's what I always say. It's crazy. We should be able to focus on our healthcare and getting better, but instead we have to deal with all these other issues, and it just gets so frustrating.
I know we touched on it earlier, but does this really just come down to this sort of uniquely American situation in which they've profitized healthcare, they've profitized illness to the point where it's necessary for the economy to survive off of keeping people sick and making their health care extremely expensive?
Well, I don't think it's necessary to keep the economy going. It's just the greed of certain individuals. CEOs want to take home, like 7-8 figure bonuses each year, or they want another private jet so they can show off to their buddies.
So there's just no political will to do it, or there's just so much money funneling into these campaigns that the people who are getting elected can't fight against the people who are putting money in their pockets.
Yeah, there's so much money sloshing around. Like I said before, the pharmaceutical industry spends more money lobbying Congress than any other industry. And it's because they make so much money pulling it out of people's pockets. and that keeps the current structure in place. Yes, it is a uniquely American problem. I think we can create a healthcare system that's affordable and creates opportunity for everybody to access it. It's just we have to have the will to do that. And I think people are just making too much money, and we're not asking. I'm not asking not to have to pay for my health insurance. I'm just asking not to be bankrupted by trying to seek out medical care or having to have the majority of my annual income go to medical expenses. And but again, it's not just for me. This is for anybody who needs access for the American healthcare system. And a lot of people, a lot of Americans at some point in their lives are going to have to do that. And it'd be nice to have a healthcare system that works for them instead of works to put money in the pockets of pharmaceutical executives, of health insurance company executives. And these people don't have to be making all this money. Like, they can be making decent salaries without pulling extra money out of the pockets of sick people. It's kind of crazy.
That is kind of crazy. And to be clear, this is a uniquely American problem, right? There are no other countries in the world in which a citizen can essentially become financially strangled or bankrupted because of their healthcare needs.
Well,
That can only
I
happen
think
in the United States.
yeah, I think we're the only developed country. I don't think every single country in the world has affordable healthcare or state-run healthcare system, but
Right.
I'm pretty sure we're the only developed country that allows that, which is
But we're also
insane.
the only country that allows pharmaceuticals to be advertised on TV. I
Hmm.
don't think any other country allows that. I could be wrong about it, but
Yeah, but
I
like,
see
why do
that
you
as
need
part
to
of the bill.
advertise drugs on TV? The decision should be between you and your doctor, not between
Because
you
there's
and.
competition, because different pharmaceutical companies make versions of the same drug, apparently. And so there's competition. So when your doctor writes a prescription to clear up your skin irritation with this product, or if you go into the doctor's office and say, I want this product because I saw, a commercial on TV. I
Yeah, but
suppose
again,
that's the
is that the most efficient way to allocate resources, by advertising a product that may or may not be superior? Because you don't
No,
know.
it's the
Or
most efficient way to
to,
allocate profits
yeah,
back into the
exactly.
shareholders.
Yeah, the
That's how you
CEO.
allocate, revenue.
Yeah, yeah, exactly.
What's wrong with that, Bob?
Nothing. I'm all for people making money. I'm just not for people. I'm just not for people profiteering off sick people.
Okay. All right. So is there any other remaining strategy or tactic you would like to see political advocates use that you think is more effective trying to get through to politicians, trying to get through to these pharmaceutical companies?
Yeah, I think it's just, if you want answers, don't be afraid to reach out, start to find those answers. And if you don't get them, share your experience with local news media outlets, either op-eds or reach out to reporters, because they're always looking for a good story.
How's
And
that working out?
what do you mean?
Well, how did that work out for you?
I mean, it worked out not bad. I got information out there, and things that I got published resulted in me speaking at rallies, speaking in forums at Capitol Hill, meeting with Congress people, meeting with senators. So it opens doors. It really does.
Okay. Yeah, I
We've
wasn't trying to be flippant necessarily,
oh
just more cynical maybe that
no,
you've done a lot of that.
yeah, I have done a lot of that, but again, I'm an individual, and my story might not be the most explosive story, but it does illustrate the experience of a lot of people. But for instance, there's a woman, I think it's in Minnesota or Wisconsin. Her son died because he couldn't afford his diabetes medication, and she's been really active in the community and doing a lot of healthcare advocacy work. And recently, President Biden enacted something that capped the cost of diabetes medications to keep them affordable. So it does have an impact. It's just that you got to get your story out there, and it's once you
Okay.
start acting up and trying to take an active stance and have a story to tell and start being able to embarrass people publicly, that's usually when the action starts happening.
Okay. Unfortunately, there's a lot of opportunities because there's a lot of people who are facing this problem. Yeah, and there's
Yeah.
nothing really funny about that. I mean,
uh,
just unfortunate. No, I
yeah.
mean, seriously, yeah,
Yeah, and
Just an
there's a lot of
unfortunate situation.
politicians that don't care. Like that state senator John DeSanto, he's sitting on that legislation, and right now there's a cancer patient paying thousands of dollars extra each year because he's not letting this vote come up for a vote. So that's a horrible story. I mean, wouldn't you like to see a commercial on air saying, "Hey, Senator DeSanto, I paid $10,000 more last year for my medication because you won't vote on this bill. Why won't you vote on this bill?"
You should make that
And
commercial.
I'm thinking about it.
All right. Well, very
Yeah.
good, man. Yeah. I think that this has been a very enlightening discussion. Many people, such as myself, don't really know the intricacies, particularly about trying to do something about this. What happens when you do try to fight back? What happens when you try to get some answers from pharmaceutical companies and politicians? Probably two of the most impenetrable sources of information that you could ever attempt to get anything from. So thank you, Bob Finkelstein.
Thank you, Jeff, for having me on. It was great to speak about this.
Great. I'm glad to give you the opportunity. I think it was a thorough discussion of a really complicated issue, and it affects nearly everyone. There's nothing more foundational than health. And I really do think that it's one of the most significant issues. It's up there. I can't think of too many others except for maybe war, and I don't know what else that is as foundational to the health of our culture and our society. So thanks for what you've done. Thanks for contributing to the discussion. And if you found this discussion informative, provocative, or maybe even infuriating, don't hesitate to stay in touch. Keep an eye out for more episodes of Sans Apologia wherever you listen to podcasts. Thanks again.